I'm Bill Noble. I'm chairing the 10th Palliative Care Congress this year in Harrogate 2014. It's been great. We've had some good people talking. You never quite know how it's going to go, how the balance of the subjects is going to suit the audience. There's a lot of clinical talks this year, probably more than usual, and it seems to be going down very well. We had a great debate on the difficulties that the specialties had with the Liverpool Care Pathway and what's going to follow it. It was an extremely wide-ranging, very well thought-out discussion from the floor. It was, I think, probably the first opportunity that the specialty has had to get together to debate it en masse, and it was extremely valuable.
I think one of the things I've enjoyed the most is the spread of topics, so you can easily choose which one would feel most relevant for yourself. Most conferences, I've found that I've got a couple of hours free. I'm finding that I'm running from session to session, and each session has been such good quality.
I've found that I can do a lot of research, things I take for granted normally.
I've enjoyed the quality of the debate because people seem to be very thoughtful, very engaged, and actually very prepared to listen to other people's points of view too, which is important.
We had a session on real science, we had a discussion on the real issues about what's facing palliative care. I think it's moving forward really nicely.
Just hearing those sorts of evidence, stories, people drawing on their own experience can mean that when you go back to your own practice tomorrow, you can do that for someone else.
It's been incredibly informative and it's given me some really great context to a new role that I'm in.
It's been a difficult year for palliative care, and it's been great actually being able to thrash things out and address the elephant in the room at times.
I've really enjoyed all the discussion, people coming to the stand, really good opportunity to interact, find out more about what people are doing. We've had lots of Macmillan nurses and different professionals who've come along to find out more about what we're doing, so it's been great.
What will happen as a result of this conference, which is why I was trying to get people in the audience to identify one action each and every one of them will do, having heard or taken part in this conversation that they hadn't thought of doing before. And that is the acid test. What will people do as a result of coming to these sorts of events?
Okay, high expectations, and that's what our patient has in us when we do clinical care for those having advanced cancer and some form of cachexia.
The Leadership Alliance has been given what, in rugby terms, is called a hospital pass, because it's likely to face criticism whatever it recommends.
Can our patients expect from us what they expect, or do we should lower expectations but set new goals?
And if we base our practice on good ideas rather than solid evidence, we are going to run into these kinds of problems.
We have to start thinking of breathlessness itself as a therapeutic target.
We have to explain and emphasise the ethical principles which undermine our practice.
Not only for patients and carers using it, but also for those of us working within it.
Now, one of my hopes and ambitions is that when I lie on my deathbed and look back at a long and illustrious career, I will think I have done something to change that, and that there will be a change in opinion that you can take I can't dance to the doctor, and that doctors are perceived as being interested in such things.